Hi, it's Andy here. So in this video I want to talk about shoulder pain and the main reason why a lot of people present with shoulder pain. I'm going to use my mate here to explain a couple of things, and I'm going to show you a really simple but effective exercise for people with shoulder pain. So most people present with shoulder pain that gives them pain to the sort of front part of the shoulder, and whilst it's going to be different for each every person that we might see in clinic, and your reasons for developing pain in the front of your shoulder will be individual to you, there are a lot of common themes that we see here in clinic, and in terms of how your shoulder's made up, make complete sense to why you might wind up with shoulder pain. So one of the first things to consider is that most people will get shoulder pain, and again here I'm talking about non-traumatic shoulder pain. So I'm not talking about if you've fallen off your bike and landed on your arm playing sport and made a rugby tackle or whatever it may be, and developed obviously a problem with your shoulder. That's different if you've had obviously an impact-based injury. What we'd call like an insidious onset injury is where maybe pain just comes for no particular reason. Being in the gym, lifting, and you've started to develop shoulder pain, and there's no real definitive mechanism that you remember doing something, or a traumatic event that's actually brought on your pain in the first instance. A lot of people will actually present with shoulder pain, particularly in the front part of the shoulder, on their dominant arm. If you think about that in a logical setting, it makes perfect sense. If a lot of what we do, and pretty much everything we do, is always out in front of us, and if you're going to use your dominant arm more than your non-dominant arm. So for me, that's my right side. So when I'm writing, when I'm reaching something, putting something away in a cupboard at home, whatever I'm doing, even when I'm driving, I'll probably put my left arm will be down here, right arm sort of up here. Most of what I'm doing is on my right side. So for a lot of people, if you actually look at yourself in sort of a mirror and have a look, you'll generally be orientated a little bit further forward on your right side, which is normal for the 99% of people on their dominant side. But what that actually means for your shoulder is that the ball in the socket, so your shoulder's a ball and socket joint, the actual ball will sit slightly further forward because your shoulder's sort of orientated forward. So that what that basically means is when you're doing any shoulder movements, so your arms moving forward, out to the sides, or whatever it may be, whatever activity you're doing, whether that's in the gym, at home, or anything else, it just basically creates less room for error. So within the actual shoulder joint itself, if the shoulder's slightly orientated forward, it just means when you go to move, the space between the ball and the socket is slightly reduced, and that then means that when you're in certain positions, particularly movements above your head, out to the sides, and even forwards, can contribute towards pain, because you will then be getting compression, or what we might call impingement, between the ball and the socket joint, and that's what's causing you the pain, particularly with overhead movements and loading movements above your head. So one of the easiest things we can do, again, requires no equipment, and I'll show you a great exercise for this in just a second, but is actually to try and stretch out the tissues in the front part of your shoulder. So if you're always in that sort of position and coming forwards, these tissues in the front part of your shoulder will become overworked, overactive, and also a little bit tighter than the structures in the back part of your shoulder. So we can actually do exercises, we can do some movements that will help to lengthen out those tissues in the front part of the shoulder. Will contribute to being able to maybe recenter that ball in the socket a little bit better, and stop that riding forward of the ball in the socket that I just sort of spoke about. So next I'm going to show you a really simple but real effective exercise to be able to do that. So give it a try. Any questions, obviously just let us know, and I'll speak to you all soon. But crack on with this, and I'll show you the exercise. So real simple exercise you can do at home, in the gym, or wherever it is, to try and lengthen out through the front part of your shoulder is like a wall pec stretch. So there's a couple of ways you can do this, and I'll show you both. So one of my probably favourite position to do is if you find a bit of wall space, literally put your palm flat on the wall, orientate your sort of chest so you can start facing your hand, and then all you're going to do is just sort of rotate away. So going from there, pushing yourself away. And what you're trying to feel there is just a real big stretch across that front part of your shoulder, so into the front part of your deltoid muscle, which is the muscle that sits in this part of your shoulder, and also into your pec muscles which run from the front of your shoulder in towards your sternum. There's another good way to do the same exercise is if you can use this in like a doorway. So let's use the corner of this wall here, where you can actually bring your arm up to the top, and again, starting your body towards the wall, you're going to rotate away, and again rotate away. So again, you're just going to be in that sort of position, arm fixed, and then, so again, you're looking for exactly the same feeling, exactly the same stretch as you were in the sort of previous example. So a stretch along that front part of your shoulder, you're helping to release and stretch out those muscles in the front part of your shoulder and into obviously your pectorals. So like I say, a really effective, no equipment needed, real quick way to improve that mobility in the front part of your shoulder.